So the next group of slides is focusing on income supports. So if you are working, if you've been working and then you need to take some time off to care for someone, you might be eligible, depending on your employer and where you're working and what benefits they offer. Um, you may be eligible for some of these private work related benefits. So some of those options may be sick pay, either using your own sick time, or sometimes people can, if you want, if you're especially if you're experiencing burnout, you can go to your general practitioner and speak to them. And then there is a sick pay through the Service Canada. It's the EI sick benefits, and you can take that if your doctor is in agreement and will complete the paperwork on your behalf. Some work employers offer what we call STD, short-term disability, or long-term disability. What we're finding now more and more is that more employers often don't provide both, but they may provide one. So it is important to be aware and perhaps speak to your employer, or if it's a large enough company, to your human resource people, and find out exactly what type of benefits you have and what they entail. And so it's just important to know, just in general, even for yourself. And the specifics of the available benefits will vary based on your employment and your insurance policy. So if you use your own benefits, you will likely require some type of diagnosis from a general practitioner. So to apply, you can talk to your employer or human resource department. There are likely eligibility criteria and paperwork that needs to be completed. And then for your own medical paperwork, you can contact your own primary care provider, whether that's a physician or perhaps a nurse practitioner in the community. So there are a number of financial supports here for caregivers. I'll just leave this slide on for a few moments. The ones I really wanted to point out are through Service Canada. So I mentioned the EI sick benefits. The other two that are helpful, can be helpful for individuals who are working, would be the caregiver leave, which is up to 15 weeks. And then following that, there is what they call a compassionate care leave, and that's up to 26 weeks. And that does require a medical certificate being completed. So oftentimes what we do here at the Cancer Center is if as a caregiver you want to take that time off, then you can request to meet with a social worker, and the social worker can help. We'll have to get a consent signed by the patient themselves, and then we send that along with the medical form up to the oncologist, and they'll complete the medical paperwork, and then it's submitted down to our health records, and then they forward it off to Service Canada. And if you wish to have, I always suggest to people, I think it's important to have your own copy for your own files. And then we also submit the forms when they go to health records. They're automatically scanned into the patient's chart. So if there's any issues or if anything comes up later, then it's all been scanned and we can have access to it and go back and review it, especially if dates need to be reviewed or something like that. So those are the key ones that I do talk about. The Service Ontario, the Ontario Works and Ontario Disability is generally for the patient themselves. If they're not able to work anymore and they need to go on a government support program.